A strong warning for pregnant women. A new study says no alcohol, none, for the safety of the baby. Chief medical correspondent Dr. Jon LaPook joins us now. All right, give me a lowdown. What does this study say?
Well, it's really reinforcing previous recommendations dating back to the Surgeon General's warning in 1981, and also the previous recommendation from the American Academy of Pediatrics saying no amount of alcohol intake should be considered safe. That's quote unquote. Now, this risk increases as the alcohol consumption increases, but even a single drink a day is linked to delayed growth, or can be linked to it.
Why pediatricians are putting it? After all, they're not experts in pregnancy. They're not experts in high-risk maternal issues. They're experts in babies and children's health.
Right. Well, this is a review of the literature that goes back over many, many years. And in the early 70s, it became apparent that there was a thing called fetal alcohol syndrome. And this was for people, women who drank a lot of alcohol, and the kids had trouble with their face. You know, they had facial eyes were wide apart,
yeah,
and their noses were flat, and they had developmental disorders. And we just thought, oh, it's just for people who drink a lot. And then it turned out that there's a whole spectrum of disorders, and that they try to say, well, is there any safe amount? But I spoke to the lead author today, and she said, first of all, it's really hard to do those studies to show, you know, what's an occasional glass of wine, one a week, one every 2 weeks. How do you do that? But then she said, look, alcohol is known to be toxic to the developing fetus, so why take the chance?
Okay, but that's like saying, why take the chance in eating soft cheese? Why take the chance in eating lunch meat because of the listeria risk? That can be the same thing. There are a lot of things that could be dangerous to a developing fetus, and yet moms all over the world eat sushi in Japan. And in Europe, drinking a glass of wine with dinner is par for the course for many pregnant moms. And by the way, having just been pregnant myself in the last few years, even high-risk doctors will say, if a glass of wine helps you relax, if it helps your stress level be lowered, go ahead. Have a glass of wine.
I totally understand that logic, right? And there is kind of a difference between what some doctors will say and what the official recommendations pretty much uniformly say by these kind of societies. But here's the deal. For the last 30 years or more, roughly 10% of women still drink during pregnancy, and 3% binge, and that's 4 or more drinks or more. That's despite the fact that these recommendations have been out. So the effect has been that a recent study of first graders found 2.5 to 5% had evidence of fetal alcohol spectrum disorder. That's a high number. Now, you don't
aren't
get
those
it.
alcoholics? Those are binge drinkers?
No. That's the point. That's the point. So alcohol is a toxin to the developing nervous system. It's a neurotoxin, and it freely goes across the placenta from the mother to the baby. And it can be present at the same amount in the blood of the baby in 2 hours. So the amount of metabolism in the mother determines how quickly it gets rid of in the baby. I understand what you're saying. I'm not trying to freak people out.
I just want to point out, there's another statistic here that women who drank while pregnant were more likely to be older than 35, college educated, and unmarried. 2 out of the 3 which apply to me. And my theory is that when you're college educated and you're older, you think you know as much as the doctor because you can go on and do your own research and find this out. So here's the research that I did in preparation for this.
Okay.
That there have been recent studies in many years, they made big national headlines about definitive studies that said light drinking, moderate drinking, there was no harm. In fact, here was a study, and Fred Bookstein, an applied statistician at University of Vienna and University of Washington, cited this from University College of London that said that. And he went on, he studies alcohol and fetal alcohol syndrome. It is no longer valid to argue that we don't know enough about low-dose drinking during pregnancy, or that the known effects of binge drinking may penetrate to low-dose drinkers somehow, meaning you know, that you have to apply the same sort of advice to low-dose drinkers. There is no detectable risk associated with light or moderate drinking during pregnancy.
Right.
He says those research dollars would be better spent on issues that truly are problematic.
So no detectable risk.
Okay.
Just because you are not able to detect something doesn't mean that it's not there. I will give you, it's very hard to study this. And, you know, I think, I don't want women who are out there who have had a drink of alcohol, certainly our parents did, and they were smoking, by the way, too, to feel guilty about this. But it's a matter of risk-benefit about what you can control and what you can't control. And what they're doing is they're coming out and they're saying, look, they've gone through all of the evidence out there, And since we cannot say there is a safe amount of alcohol, and since we know, just in terms of the way that the alcohol is able to cross over into the baby, and especially at the beginning, as things are dividing, those dividing cells, especially in the brain, can be damaged by a toxin like alcohol, which is a direct toxin.
Wait, but many women don't even know they're pregnant at the early stages.
That's very true. That's very true. And it's very hard to know, well, I'll tell you something about that, about the pregnancy thing, right? The first 8 weeks, there's no placenta. So there's no alcohol getting from the mother into the baby. It's only once you get a placenta developed, and I may be a little bit off by the number of weeks, but until you get that placenta, you don't have the ability of the alcohol to go from you to the baby. So remember, there's that egg which has all those nutrients. So the baby's okay at the beginning, and then once there's connection to you, what you take can go to the baby.
Right now, there are women all around the globe going,
I totally get it. But, it's also your own risk. I have patients who I know, if something, God forbid, were to happen to the baby, afterwards they all come back and they think, what did I do? And the truth is, we're not that powerful for a lot of the problems, but you don't want to say, oh, there would have been something that I could have done. How hard is it to go without a drink for 9 months? Okay, pretty hard, right? I see it in your eyes. I see it in your eyes. But is it worth it?
It's a great question. Dr. Jon LaPook, thank you.